It's like
I was gonna say good morning. Good afternoon.
Good afternoon.
Oh, welcome to our
Wednesday.
Wellness Wednesday.
What? Wednesday wellness?
Well, whatever. It's
Whatever
Wednesday.
we call these things.
It's a wellness day. We're here to chat with you live.
Coming
at you live.
We're twinsing today.
Yeah, we are twins, and we
Yeah.
have planet once again.
Yep.
Okay, so today we're going to talk about the Webster Technique.
Yep.
But because we've already reviewed what is chiropractic, we've reviewed the nervous system, what it does.
Yep.
Parasympathetic, sympathetic.
Today.
Yeah.
The sushi we had for lunch.
I know, right? Poison.
Tripping over our tongues now.
And then we talked about our scans.
Yep.
How we address subluxation, what's going on in the nervous system.
And
all
vagus
that.
nerve and stuff.
Vagus
like that.
nerve. We talked about all that. You want to know what's going on? Go look at our old videos.
Yeah, we put them up on YouTube too.
Yeah.
So if you're bored one night and just like browsing through YouTube, you can hop on there, check out our videos.
Talking to us.
Yeah.
So now we're going to talk about the Webster Technique because we focus a lot on pregnancy in the office. We get many phone calls. New patients will call and say, hey, we see you're certified in Webster. We want to start care with you. They don't even know what that means, so we're going to tell you what that means.
Yep. I'll tell you all about it.
Dr. Annie.
Okay.
We'll start.
So, as you know, we're addressing your spine and all that good stuff. But with pregnancy, there's a lot of changes that happen to your pelvis, and because of like gravity shifting, center of gravity shifting when you're pregnant and stuff, a lot of focus on low back, sacrum, and then your two pelvic bones too. So Webster Technique is basically an analysis of the pelvis and a technique to help realign that. The reason that's super important is because, well, your pelvis, these two big SI joints here, sacroiliac joints, are what holds us up. That's basically like what our spine sits on. This is the biggest joints that hold our center of gravity. And so when we have a baby growing in our pelvis, in our uterus, as Rachel's demonstrating, it puts a lot of pressure on these SI joints. So part of that also is we have relaxin in our system that is helping to soften our joints, and it can create a loosey-goosey pelvis.
So baby can exit.
Yep, exactly. But that also kind of precedes us to have more injuries in the SI joints of that area. It can lead to more hypermobility, that kind of stuff.
Right. Pregnancy people will come in because obviously they have low back pain, maybe they have round ligament pain, sciatica.
Yeah, that's
fewer
the reason that
exhibits
we see
pain.
all
Yeah,
that
so it's
stuff.
why people show up here, and then usually, but they have heard you should see a Webster certified chiropractor.
Yes,
because we specialize in pregnancy and we analyze the pelvis to relieve all that, but also allow for easier labor delivery.
Yes.
Because.
Yeah, exactly. So dystocia is what we call difficult labor. And so when baby's coming out during labor, there are three things that can cause dystocia. So it's power, passage, and passenger. Power refers to how efficiently your uterus is contracting and how well that's working. So part of
A nice picture here of
Yeah.
the uterus.
There we go. Uterus diagram here. So we have these round ligaments here that go right through the front of our pelvis here. And then there's the uterosacral ligaments that hold them into the back of our pelvis. So if there is any like torsion or misalignment of the pelvis, you can see how with the uterus connected to the inside of the pelvis here, if there's torsion there, it's going to create torsion in the muscle that is the uterus. And so when there's contraction, that contraction isn't going to necessarily happen symmetrically, or it's just more difficult, which decreases power.
Yes.
And-
Or the nerve innervation to the actual uterus.
Yep.
Right.
Exactly. So the uterus is also innervated by some of the nerves in the upper low back, and then also from the sacral plexus right here. So this is how our brain communicates with our uterus during labor and during contractions. So that's another reason why chiropractic is so important for labor specifically. So we want to have good power, so that is from the muscle, the communication there.
You need good power, you need good contractions, you need that baby's head hitting that cervix to dilate it.
Yep, and to all send feedback through the nervous
Yes.
system.
Efficiently.
Yep. So passage is the next one. Passage is the pelvic outlet. So where the baby's head is going to pass through, we want to have good symmetrical openings. So again, there's like pelvic floor muscles that cover this area. So if there's any misalignment here, it's going to cause tension in those pelvic floor muscles, so it's going to be harder for baby to come out, that pelvic opening. But also, any misalignment here is going to decrease the opening space. So it's going to make it harder for the pelvis to open up for baby.
Any, you're talking about, sorry, misalignment, is that what you're talking about?
Yes, yep.
Yeah, so any misalignment, which is what us chiropractors are looking for, right? Misalignments in the spine, misalignments in the
Yep.
pelvis.
That's exactly like what Webster Technique is.
Yeah,
To the
so
core.
if
Yep.
this is how baby should exit and pelvis is like that, it's obviously going to create an issue.
Yeah, and I
Exaggerating
mean,
it.
again, there's a bunch of muscles and ligaments and stuff here. So if this is pulling over here, then baby only has kind of this side to go out. So that's where a lot of like if baby's shoulder gets stuck or things like that, like during labor, labor's not progressing, or a lot of times it can be one of those factors.
Yeah, so we're checking. So just by checking bones, like the bony pelvis, the
Yep.
spine, we're contributing to power.
Mm-hmm.
So good nervous system,
Yep.
communication, and then passage.
Yep. And then the third one is passenger.
Well,
So that is.
can I say one more thing?
Yes. Yeah.
With passage is also the uterus with all the ligaments and stuff. Because if there's twisting of the pelvis, the uterus isn't sitting in there properly, and then there's usually twisting, torsion of the round ligaments.
Yes. So that is another thing. That's the soft tissue part of Webster
Yeah.
Technique that we're addressing too. I'm gonna grab this guy again.
Yep. So not only are we addressing, so this is where maybe you would see a difference between a chiropractor that is Webster certified and not. Like they can, every chiropractor can adjust pregnant women, they can adjust the spine. But with Webster certification, we are also looking at the soft tissue. We're looking at the round ligament. Like, is it tighter on one side compared to another based off our Webster analysis?
Yeah.
Are releasing, like, does round ligament need to be released to get uterus in best position, to have baby in best position, but also psoas release.
Yeah.
Big old muscle in the front there.
Yep. So we also have a lot of muscles in the front. We have a piriformis muscle in the back too. So all of these help balance the pelvis. So if there is any imbalances there, then those muscles tend to freak out and are trying to stabilize the hypermobile pelvis, basically. So
I guess it kind of goes with passenger also.
Yeah.
You can go. You can do
so passenger, the third factor.
These are like all what OBs learn about too. Power, passes, passenger.
Yeah, this
This
is
isn't
all
just a
based on
chiropractic
Williams
thing.
Obstetrics, which
Yeah.
is like the textbook
Yes.
for OBs. And so passenger is referring to the baby's position because we want them, most people know, we want them to be in a head down position for birth. And there is like ideal alignment with all of that.
Yeah, I was gonna say not only is head down ideal, but like centered head down. Are they left away? Are they? I mean, there's a lot about how they are head down.
Their
also,
ideal positioning.
to
Yeah,
make sure that like they're coming out nice and centered and not at an angle and like banging.
And then when they rotate as they're coming out too, they can do that most efficiently also. To watch out for mom's anatomy. But something that's super cool about most pregnancies, babies know how to get into the right position by themselves. Just innately, they know how. So when that like timing goes right, most of the time baby will get into the right position. And if they aren't, sometimes we'll get referrals for moms who have like breech babies or transverse babies, sunny side up babies. So what we do with that is, again, we're working on that passage aspect of it. So we're looking at the alignment of the pelvis, we're looking at the soft tissues, the round ligaments, the uterosacral ligaments, psoas muscle, all that stuff to see if there is any torquing in the pelvis.
we're even looking at like the
IT band.
not IT band, those six
Deep six flexors.
Yeah, deep six flexors. So like, what are those ones on those hips? You know if you've been here, you know what muscles we're looking at.
Yep, exactly.
Because I mean, weak muscles on a side, tight ligaments on another side, all of that is going to affect how baby is positioned.
Yep.
How you're carrying baby.
Because it depends on how your pelvis is positioned too, and that's going to create torsion or tension in the uterus.
Can create like an
affects
uncomfortable
baby
pregnancy, but like our main goal is like we hope you have a great pregnancy, but also a really great labor and delivery. You know, where you don't need an intervention in some sort. Because a lot of those where you have a difficult labor or labor stalls, it ends in an intervention, whether that be a C-section or forceps or vacuum. You want to prevent that for mom and prevent that for baby.
Even that kind of stuff, epidural, all of that affects how labor goes and how it progresses, and then also how well you and baby recover after the birth too. So that's why can you tell how passionate we are about this?
Very passionate. Super passionate about it. Yeah. We just like love when we get the phone call that mom had a great birth went great. Just had that.
Oh yeah. We get
yesterday.
We get those emails all the time.
Or Monday.
They're the best.
Oh yeah.
We love it when there's pictures of babies in
Yeah.
there also.
Yeah. So yeah, find a Webster certified chiropractor if you're
Yeah.
pregnant.
If you aren't in Grand Rapids and you're looking for somebody, check out the ICPA website because you can look for Webster certified chiropractors on there. So that's who we do our certification through. It's the International Chiropractic Pediatrics Association. That's also who I have my pediatric certification through also. But they're
We've
awesome.
done like
It's the best
advanced training past Webster certification.
Yeah.
With pregnancy even, so
Yeah, because we're big pregnancy nerds and
we love it.
Yeah.
So yeah, let us know if you have any questions. I feel that's a pretty good explanation of it.
Yeah.
All right, awesome.
Shoot us questions in the comments below if you have any. If we didn't cover something.
Yeah, if you have a
well enough,
question or like why it would help with a certain thing going on, or maybe something happened to your labor and didn't. We get a lot of moms even who are like hoping for a VBAC this time around because first time didn't go as planned.
Yeah, we have quite a few of those right
Yeah.
now, which is really awesome.
Yes.
Yeah.
And so, and we have had patients have had successful labor delivery. You know, they usually ended in C-section the first time because labor did not progress. Like we were just talking about. Here's 3 reasons why your labor maybe didn't progress. So here are 3 things we are focusing on, so your labor will hopefully go better.
Yeah, and then they usually have really great birth outcomes.
Yeah.
After. So.
Awesome. All right. Have a great week. We'll see you next week.
All right.
Talking about something.
Probably babies or something.
Babies.
Something else
Chiropractic.
with pregnancy.